I just want to cover atherosclerosis, heart disease, and heart attacks because when you go to your doctor's office, you're going to see a chart or image very similar to this. Clean vessel and then a dirty plaqued vessel. And it kind of implies that cholesterol and other things inside the vessel is contributing to this plaque. But it's really not quite the case, and this has been known since a German pathologist did this study in 1876. So we've really known the true way vessels deteriorate through plaquing and the atherosclerosis, hardening of the arteries, and heart disease process. And that is the following. So really, every vessel, whether it be large or small, needs to have a capillary, one of these small vessels, within 3 cell diameters. So really, this is not where the disease starts. The disease starts in this little area called the vasa vasorum on the outside, where we see buildup of plaquing, buildup of inflammation, hypoxia, and then we have an immune response, which really contributes to a greater growth of plaque in the small vessels and then eventually in the large vessels. So heart disease is really a disease of the small vessels of the large vessels. And we can measure that very accurately with a number of our biomarkers that we use that constitute the chronic disease temperature. So let's take a look at some of those. So white blood cells, white blood cell counts is a really good way to understand the health of these vessels. So white blood cells are produced in the bone marrow and the thymus, and they're recruited into the vessels to clean up largely inflammation and bacteria. And when your white blood cells go up, that means there's probably some damaging process going on in that tissue that the white blood cells are coming to the rescue in your body to correct that process. So white blood cells are elevated, and sometimes it will just be smoldering inflammation or a low-grade chronic infection. So any value outside of 4,000 to 6,000 really implies that you have an infectious or an inflammatory disease process going on right inside your vessels, or the white blood cells are coming there to the rescue. So you're much more likely to have an ischemic blockage or a hemorrhagic, a breakage of vessels when your blood cell count, your white blood cell count, are below 4,000 or above 6,000. White blood cells elevate for cancer. It's well known. There's ample support to link inflammation, infection, and cancer. And white blood cells are found in large numbers in tumors. So they may be in tumors, but overall, systemically, your white blood cell counts may not be super elevated. In fact, they might even be suppressed a little bit, but they're accumulating in the tumor itself. So the quantity of white blood cells correlates with tumor stage and prognosis. And it's a little tricky because virus and tumor cells, cancer, can actually suppress white blood cells or cause an elevation. So it requires a little art to understand the difference. Let's look at marker number 7, absolute neutrophils. So neutrophils are a type of white blood cell. They are particularly present when bacterial infections are present, along with allergies and inflammation. So we can see the white blood cells go up. We might see the neutrophils, a subcount of your total white blood cells, go up even more profoundly because you have a bacterial infection as opposed to a parasite or a virus or fungal infection or something of that nature. So chronic infections promote inflammation in the body and may increase the risk of heart disease, cancer, respiratory diseases, neurological diseases. So you can see, even though the white blood cell counts and the neutrophils are what are called nonspecific, they're telling you about a lot of the major disease processes going on in your body. So another marker we use, I'll call chronic disease temperature marker number 8, is the percent neutrophil. So before it was the total amount of neutrophils. Now it's the relative percent of the neutrophils out of your total white blood cell count. So white blood cells constitute these 5 different types, and neutrophil is one type and usually the most prominent type. And the ideal value is between 40 and 60%. 40 and 60% of your white blood cells will be neutrophils in a relatively healthy individual. But we see a lot of people at 65, 70, sometimes even 80%. That person, regardless of how high the white blood cell counts are, they have a chronic bacterial infection going on. If the white blood cell counts are low, it's a low-grade infection, but it's still bacterial if the neutrophil percent is 60 or above. 40 and below, it usually implies some sort of an elevation in lymphocytes, which are very often related to autoimmune diseases and cancer. So the neutrophil to lymphocyte ratio is a really powerful scale. It takes the predictive power of neutrophils, absolute neutrophils, and the knowledge that lymphocytes can actually suppress white blood cell counts, and so it creates a very amplified scale. So we use the neutrophil to lymphocyte ratio for both cancer prognosis, infection prognosis, cardiovascular disease prognosis, and now Dana-Farber at Harvard is using the neutrophil to lymphocyte ratio to understand cancer risk, and particularly if your value is high, like 4 or 5, you're the person who's going to die when you are treated with chemotherapy for a tumor, for a cancer, because you have infectious processes going on, and the chemotherapy will suppress your immune system and really exacerbate that situation. Marker number 10 is your red blood cell distribution width. And this is a really interesting one because a red blood cell is a three-dimensional disc, and a capillary is somewhat of a round tube, if you will, very small tube, a micron level, and your red blood cells literally have to squeeze to get through the capillary. And in so doing, if you have inflammation, infection, plaquing inside your capillary, then your red blood cells, which are physical structures, will actually get all bent out of shape because they have to squeeze through, and the red blood cells will literally become swollen and enlarged over time. So in the back of the eye, with instruments to look at the micro capillaries or capillaries, we can see the red blood cells squeezing through the membrane of the capillary vessel. So here's the capillary vessel, the membrane, and here are the red blood cells. So we really can tell what's going on right inside your blood vessels by measuring the red blood cell distribution width, which ideally would be 11 to 12.5%. The next marker is C-reactive protein, and this is really a marker for inflammation. And a lot of folks are now thinking, researchers are now thinking, that C-reactive protein goes up when there's inflammation and infection as a protective agent, or at least as a signaling agent. And the Heart Association says you want to have a CRP of 1 or less. 1 to 2 is a moderate heart risk, and anything over 2 is a high CRP or a high heart disease or inflammatory risk. We've seen through mortality studies that an ideal value is 0.6 milligrams per liter or less. And CRP, once again, is nonspecific, but it tells you about all these different states of adverse chronic health. Homocysteine is another great marker. It's involved in a number of processes, and it's an inflammatory marker, and it's an amino acid that tells us a lot about enzyme action and nutrition, B vitamins in particular. So elevated levels of homocysteine can pose us a significant risk. If your body doesn't have the proper enzymes to clear homocysteine, then the homocysteine alone will create collateral damage and cause damage in your arteries. So lack of nutrients, genetic defects may also cause high homocysteine values, which is not necessarily a death sentence because certain B vitamin supplements can circumvent this genetic defect and allow homocysteine levels to go down. Dr. Tom Lewis, thank you very much.